Everyone, this is Rishmitha Para. Today I am going to discuss from predictive modeling. In the predictive modeling, the first one is lasso regression. We utilize lasso regression or the least absolute shrinkage and selection operator. This technique is particularly useful for future selection because it provides less significant predictors by shrinking the coefficient towards zero. To this approach, we could identify key predictors of treatment remission such as baseline medical conditions, adherence to treatment, and prior use of antidepressants. By focusing only on significant variables, lasso regression reduces the complexity of the model, ensuring that only the most impactable features are included in the analysis. And then the integrated interaction terms. To enhance this predictive power, we integrated interaction terms. These terms capture the relationship between variables that may not be evident individually. For instance, our study revealed how treatment duration interacts with certain comorbidities to influence remission outcomes. By including these interaction terms, the model could better account for the combined effects of variables, providing a more detailed understanding of what drives treatment success. And then the training and validation using cross-validation techniques. To ensure the reliability and generalizability of our predictions, we applied cross-validation technique during the training process. The dataset was divided into multiple folds, with each fold used as a validation set, while the remaining data trained the model. This iterative process not only reduced the risk of overfitting, but also ensured that the model's performance was consistent across different subsets of the data. Matrices such as R-square in our case demonstrate the model high predictive accuracy. This robust framework validates the effectiveness of our approach and underscores the importance of training and testing methods. And then coming for the results for predictive modeling. The accuracy. The model achieved an accuracy of 65%, which indicates that 65% of the predictions matched the actual outcomes. This metric provides a general sense of model's performance but should be interpreted alongside other matrices for comparative evaluation. And then we are going to discuss the precision and recall. For class 0 non-remission, the model showed a precision of 67%, meaning that 67% of the predicted non-remission cases were correct. The recall for class 0 was 92%, showing the model effectively captured most of the actual non-remission cases. For class 1 remission, the model has a precision of 56%, indicate that 56% of the predicted remission cases were correct. However, the recall was lower at 18%, meaning that many actual remission cases were missed by the model. And then coming to F1 score. F1 score for class 0 was 0.77, a good balance between a precision and a recall, reflecting reliable predictions for non-remission cases. For class 1, the F1 score was lower at 0.27, suggesting that predictions for remission was less reliable due to the lower recall. And then going to the macro average F1 score was 0.52, which gives equal weight to both classes. This average indicates moderate performance overall. The weight average F1 score, which accounts for class imbalance, was 0.59, reflecting the domains of class 0 in the datasets. And then the model regulation. The selected alpha value was 0.0028, which controls the strength of lasso regularization. This value ensures that the model balances complexity and performance effectively. And then the model fit the McFadden R-square value of 0.0383 indicates a proportion of variance explained by the model. Although the value is modest, it is expected in logistic regression, especially with complex datasets. And then coming to intercept, the intercept value of minus 0.7271 represents the baseline log odds of remission when all the predictors are at 0. This value serves as a starting point for predictions before accounting for the effects of specific features. And then the evaluation matrices. This slide highlights the evaluation matrices use it to access the performance of our predictive model. Let's break it down. The matrices used were R-square, mean squared error, and area under the curve. First, coming to R-square. The R-square value measures how well the model explains the variance in the data. It represents the proportion of the variability in the target variable that is accounted for by the predictors. In our analysis, the R-square indicates the strength of a relationship between the features and the outcomes, providing an overall measure of the model fit. And then the mean square error calculates the average squared differences between the predicted and the actual values. A lower mean square error indicates that the model predictions are closer to actual outcomes, reflecting better performance. It is particularly useful for understanding how well the model performance on continuous data or the regression task. And then the area under the curve, receiver operation characteristic. The area under curve receiver operator characteristic is a critical metric for classification models. It measures the ability of the model to distinguish between the classes, particularly in imbalanced datasets. A higher AUC-ROC value indicates that the model performs well in separating positive-negative classes, making it an essential metric for assessing binary classification. And then the sensitivity analysis. To ensure the robustness of our results, we conducted sensitivity analysis. This involved testing the model's performance under different conditions and assumptions, helping us to evaluate its stability and reliability. Sensitivity analysis also provides insights into how variations in data or model parameters affect the overall outcomes. These matrices collectively ensure that the model's performance is robust and reliable, balancing accuracy, variance explanation, and classification ability. The use of the sensitivity analysis further strengthens the credibility of our findings. To conclusion, our study effectively highlights the importance of addressing missing data in large-scale health datasets, such as all of us research platform. Missing data can be significantly impact the reliability and validity of analysis, particularly when studying the efficacy of treatments like Amitriptyline, which is used for depression and chronic pain. By implementing advanced imputation techniques such as multiple imputation by chained equations, k-nearest neighbors, and regression-based imputation, we are able to recover missing values in the key variables. These methods not only improve data completeness but also preserve the relationship between the variables, ensuring the integrity of datasets. Our predictive modeling approach, which employed lasso regression and logistic regression, identified significant predictors of treatment outcomes, such as age, baseline medical conditions, and prior medical history. The inclusion of interaction terms enabled the understanding of how multiple factors work together to influence the treatment success. This robust framework can be achieved in R-square, demonstrating the accuracy. A metric like AUC-ROC further validates the model's effectiveness in distinguishing between remission and non-remission cases. The framework established in this study not only applicable to amitriptyline but also adaptable to other precision medical research areas by tackling challenges associated with this missing data and advancing model techniques. We have created a replicable and scalable process that can support broader objectives in healthcare analytics. To summarize this research, the critical role of handling missing data for reliable outcomes, the importance of integrating robust predictive models for treating insights, and the value of applying this framework to future studies in precision medicine. Looking ahead, there are several key directions for extending and improving this research. And the first one is expanding datasets. One of the most important next steps is to broaden the dataset by incorporating genetic and environmental factors. These variables are critical for understanding the full range of influences on treating outcomes in precision medicine. For example, the genetic predispositions can reveal why certain individuals respond different to amitriptyline, while environmental factors such as socioeconomic status or lifestyle can provide additional context for treatment. Applying advanced machine learning models. While our current approach relied on lasso regression and logistic regression, future research could benefit from using most advanced missing language techniques such as random forest, gradient boosting machines, or neural networks. These models can capture non-linear relationships and complex interactions between features, potentially improving the accuracy and robustness of predictions. Additionally, explainable AI can be integrated to interrupt the model decisions effectively, and then the validate findings across diverse cohorts. To ensure the generalizability of our findings, it is essential to validate the models using diverse cohorts. This includes populations while varying demographics, medical histories, and geographic regions. Such validation will help assess whether the predictors identified in this study hold true across different groups, ultimately contributing to most inclusive healthcare solutions. And I want to conclude by expanding these data sets, applying cutting edge modeling techniques, and validating the findings across diverse populations. Future work can build on this research to further advance precision medicine. These efforts will not only enhance the understanding of treatment outcomes for amitriptyline, but also set a benchmark for missing data challenges in other healthcare domains. These are the several references we used for completing this project. Thank you all for your time and attention, and special thanks to our professor Farooq Alami for guiding, support, and giving us insights throughout this project. And I also want to thank Vlad for providing expert guidance and assistance in navigating the All of Us research project. Thank you all.